the internationally acclaimed On Stage with Winford Williams.
At a new time, Saturdays at 8 p.m. on CVM TV.
So much more than entertainment.
Younger, brought to you by
Hyundai or Hyundai.
The following program has been rated PG-13 and is suitable for viewers over the age of 13 years.
It's Tuesday, November 19, 2024. This is CVM News at noon. I'm Ramon Gordon. Opposition leader Mark Golding has responded to claims by the Prime Minister that some are using recent protests for political gain. His comments follows Monday's industrial action by workers at the Excellence Oyster Bay in Trelawney.
It is frankly disrespectful to the serious concerns of tourism workers to suggest that they are being politically manipulated when they take action to have their grievances addressed. Instead of the Prime Minister seeking to pass the buck by blaming the People's National Party for the current unrest in the sector, he should take responsibility for failing to address these issues in the sector over the last 9 years. The PNP will continue to advocate for the protection of workers' rights and the establishment of mechanisms to ensure a sustainable and harmonious tourism sector.
That response follows another wave of protests that hit the local tourism sector on Monday. The latest action happened in Trelawney, drawing the attention from national leaders. Shante McNeil has this report.
For the fourth time this month, hotel workers took to the streets over low wages, this time at Excellent Oyster Bay in Trelawney. Similar protests erupted last week at Ibero Star, Secrets, and Breathless Resorts in Montego Bay, as well as last month at Royalton in Negril. Frustrated and at their breaking point, workers from Excellence Oyster Bay voiced their grievances.
The money needs to come in every day and new rules implement, workload get heavier and the money not there to back it. It's just more work and more work. I am a bar server and I'm doing so many things outside of my contract that has nothing to do with the bar.
You have to spend money out of your own pocket to get health care. If you got dentist, miss one time for ear care. You use it once, you can't use it twice. You can't use it again. And every fortnight, then take your money out of your money. So where money you go?
We have to be signing contracts. They only give us 3 months. And then for the 3 months, they keep, when this 3 months end, they extend your right to a year. And then send you on contract break. They're not letting it reach the year because if it reach the year, you have to get staff. And they're not issuing out any staff. We work 10 hours overtime, we get in 2, 3, 4, and they're telling us that they can't pay us for all of the overtime.
Meanwhile, Prime Minister Andrew Holness addressed the issue at the Portland Constituency Conference last night, acknowledging the workers' concerns and calling on the Tourism Ministry to take action.
So, Minister Bartlett has been tasked to bring the sector together, to have real dialogue about how we're going to ensure that our workers in the tourism industry, that they are happy. There are many issues there. It's not just about pay. Sometimes, in fact, most times, it is about the conditions under which they work.
However, Holness also accused some individuals of exploiting the protest for political gain.
There are those who want to take political advantage of the grievances and are fueling industrial action for political point scoring so that they can get political power. I want you to stop and consider that those people who are behind the scenes agitating for political reasons, when they had the political power, they couldn't grow the tourism industry.
For CVM News, I'm Shante McNeil.
United Way of Jamaica is helping farmers recover from Hurricane Beryl's devastation. Nearly 100 Clarendon farmers have received baby chicks and feed through the NGO's latest initiative to support the island's food supply.
Note is that we are able to generate or mobilize these funds from several partners. But for Clarendon, our donor is Scotia Canada. For all the other parishes, we had City Jamaica, Fidelity Motors, even a group of girls from a prep school who did a cake sale and raised some funds. And then we also have an individual who's, ironically, her name is Beryl Gray, who also, through her network, raised some funds. So whether you're an individual or you're corporate or whatever it is, all hands on deck, come on board, partner with the United Way of Jamaica, partner with the Jamaica Agricultural Society, visit our website, yes, at unitedwayofjamaica.org, visit our website and come on board and join us as we empower our farmers for a better Jamaica.
For Pharmacy Week, Sunrise featured CariMed Group representatives explaining the difference between allergies and the flu, a timely topic as many blame seasonal changes for runny noses, sneezing and coughing.
Right, so you can have allergies that causes runny nose, sneezing, itchy, watery eyes, as well as stuffiness in the nose and a cough, especially if the person is experiencing what they call draining in the back of the throat.
Post-nasal drip.
Right, post-nasal drip, that's the correct term. And then you can have sinusitis, which is inflammation of the sinus, right? And
because we all have sinuses,
right,
by the
so
way.
everybody has sinuses in the face, right? You have sinus cavities. And when these cavities become blocked, right, you can, by inflammation, you can get a sinus infection, which is normally caused by a virus or a bacteria. So when you have that, you'll typically have fever, as you would expect with an infection. You can also have a change in the color of the mucus, or what Jamaican people say coal, them coal change color.
Yeah, green,
right?
yellow, them stop them.
Right, so that's an infection, right? You can also have loss of smell with sinus infection. So those are things to look out for. If it's just itchy, watery eyes, red eyes, itchy nose, sneezing, runny nose, that's allergies.
So apart from being sick, we also want people to remind themselves to also take your vitamins during this period as well. So you have the Vigat and Hemafits, need to develop your immune system. So we at FP have all of the products to really keep you sick and keep your immune system strong, right? So that's why we say check up your medicine cabinet, and you can see everything that is there, everything that you need to carry right throughout the day.
News at Noon continues in a moment.
The internationally acclaimed On Stage with Winfred Williams.
At a new time, Saturdays at 8 p.m. on CVM TV.
So much more than entertainment.
Supermed Family of Pharmacies, your trusted partner in health and wellness for over 30 years. With 8 convenient pharmacies across Eastern Jamaica. Supermed Mall Pharmacy, Supermed New Kingston, Supermed Pepine, Supermed Port Antonio Pharmacies 1 and 2, Claire's St. Mary, Lloyd's St. Thomas, and a convenient drive-through at our Hughenden location where you can get your medication without leaving your car. We're dedicated to providing you with the highest level of care. Experience the difference with Supermed Family of Pharmacies. Super happy, super healthy.
And you go down and have a good day. Blessing. Supermed.
Let's take a trip to the future. Join the JPS Foundation at the Climate Action Conference and Expo on November 30 at the Chinese Benevolent Association. Hosted by CJ Sparks and Paula Ann Porter-Jones. Explore Sustainability City, meet our Power Up Energy Club Innovation Challenge finalists. And check out career options at the Career Corner. Test drive electric cars and dive into cutting-edge tech. Plus, our immersive teaching tunnel will show you how you can take action for a sustainable future. Follow us on IG and Facebook at JPS Foundation to learn more.
Welcome back. It's now time for our discussion segment. The Department of Correctional Services has suspended visitations to all adult and juvenile correctional facilities until December 2, following reports of the influenza virus in 2 prisons and the death of 2 inmates. Joining us to discuss are Dr. Donna Michelle Royer-Powell, Director of Medical Services at the DCS, and Ms. Jade Williams, Policy and Advocacy Specialist at Jamaicans for Justice. Welcome to you both.
Thank you.
Dr. Powell, let's begin with you. What can you tell us about the current health status in prisons, and how is the department managing the outbreak?
Okay, thanks for that question. We have a medical team, and the medical team has been providing coverage at the various institutions daily. Even up to Sunday, we deployed medical officers as well as medical assistants to the St. Catherine Adult Correctional Center, where we have had the 2 deaths. We are also working in conjunction with the St. Catherine Health Department to investigate the illnesses as well as to provide medical care and to plot the way forward.
Right. Dr. Powell, can you confirm whether or not there have been any other reports of these cases at any other facilities?
We have 1 confirmed case at Tower Street. We're still awaiting some results from some samples that were taken at other facilities. So I cannot confirm that we have the influenza virus. We do have inmates who have presented with flu-like symptoms and would meet the criteria. However, we do not have a laboratory confirmation.
Very well. For our audience, please, can you outline the steps taken to care for sick inmates? They show these symptoms. What's the immediate next steps?
Okay. The influenza virus is a virus, and therefore we manage the symptoms. So if you are having a cough, we will give you something to deal with the cough. If you are stuffy, you'll get antihistamines. We isolate the sick ones, right, as best as we can. Many of the facilities are overcrowded, so trying to find a specific area to isolate persons sometimes is a challenge. However, we try with the resources that we have to isolate and monitor those who are sick.
Well, how common is it that influenza is fatal, Doc?
It is not very common. Many people get influenza and don't even know. They might just have a mild headache. It depends. Most of these viral illnesses can be a spectrum. So some persons will get a mild fever, maybe headache, maybe a cough, and just feel generally weak. And then you have the extreme where the person is going to be hypoxic. They're really vomiting, having diarrhea. So there's a spectrum.
Thank you so
majority of our inmates are not critically ill. They're ill, but they're not on the verge of that they need to be in a hospital.
Got it. Ms. Williams, you've been listening in. We've heard concerns about overcrowding. They're not new. What other concerns, if any, does Jamaicans for Justice have about how health emergencies are handled in correctional facilities?
Well, we don't really speak to the handling of the emergency per se, but just to say that to handle a health emergency would be hindered by the conditions of the lockups, particularly those health issues that are easily transmittable by air or by fluids. So what we have found is the conditions of the lockup, as you mentioned, the overcrowding situation that leads to instances of poor ventilation. We've seen at least one case of crushing in lockup due to the overcrowding issues. But also there are concerns about the actual sanitation of the lockups, the quality of the food that the inmates receive. So some of those things we believe would contribute to the spread of disease and also would hinder those persons who are working diligently to manage the spread of disease in lockups here.
Dr. Powell, you heard those concerns. Now, with visitation restrictions now in place, are there any other safeguards being implemented to protect inmates and the staff? What's the protocol there? Dr. Powell, are you with us? Seems we've lost her momentarily. Jade, back to you. What improvements then would Jamaicans for Justice suggest to strengthen the healthcare in correctional facilities? We've heard the concerns. What are the steps for remedy?
Well, for sure, we definitely need to see some new correctional facilities, some improved infrastructure is necessary first. Some of the issues that we're seeing is due to the inability to actually rehabilitate the buildings that the inmates are being housed in now. The buildings are simply too old and unsuited for what it is that we're trying to do. So firstly, we need some new and improved facilities, but also we need to see greater adherence and resources put towards the maintenance of these facilities as in accordance with our obligations under our local laws and policies. So to see cells constantly clean, to see that inmates have access to clean running water, to see that there are proper sanitation facilities, including toilets and bathrooms, to see that cells hold the appropriate amounts of inmates and have proper ventilation, to ensure that there is pest infestation management in these facilities. All of these things are steps that we believe are necessary to be taken to improve the quality of the life of persons that are in lockups. And we like to emphasize that these persons, in the case of lockups in particular, are simply people awaiting trial. And therefore, we have to, in maintaining their presumption of innocence, also ensure that the conditions in which they are being held are not such to punish them before it is necessary to do so.
Ms. Williams, how can advocacy groups like yourselves and the public support efforts to improve these health standards? We're advocating here on television, but on a matter of policy, what changes should we be, championing more specifically?
Well, we are... It is not that we don't have the policies, we do have them. And I think what we are looking towards as it relates to policy is really implementation. We need to see greater take-up of the good policies that we have.
Talk to us a little about those good policies, Jade. Some of the policies you consider good. Talk to us a little about those.
Well, I know the Department of Correctional Services would have its correctional policy that speaks to the management of all correctional facilities, and it does have excellent standards in it. If those standards were being adhered to a T, I think we wouldn't be having the amount of complaints that we have now. So fortunately, the policies are there. What we need to see is strength in implementation and resources to support those persons who are implementing the policies on the ground.
Got it. Thank you so much, Jada. Here we have Dr. Powell back.
Yes, but I cannot comment on anything that Ms. Williams has said because I was off.
Sure, that's fine. I'll carry you right back into the conversation. Let's talk long-term strategy. We've heard the concerns about infrastructure, about overcrowding and all else. What are the long-term plans to address health management challenges in correctional facilities? You can come back in there.
Well, we have increased our staff complement over the last 3 to 4 years. I mean, almost 100%. We now have 10 full-time medical officers, 5 full-time psychiatrists, an obstetrician and gynecologist. We have a full-time dentist. We're about to employ another dentist. We have a pharmacist. We're in the works for getting a dietitian. So in terms of the medical staff, we have medical assistants. We have trained correctional officers as physician assistants, as well as psychiatric nursing aides. We also have patient care assistants. We've modified part of Tamarind Farm to have an infirmary so that we can care for those who cannot care for themselves, who are elderly and will be with us for a